The family of a 22-year-old woman who tragically took her own life after being diagnosed with Lyme disease said the illness had hijacked her, leaving her in unbearable pain. Amélie Champagne, from Montreal in Quebec, had received the diagnosis in June this year after spending years trying to work out what was causing her poor health. Watch the video above, How to Protect Yourself from Lyme Disease. For more real-life related news and videos, check out Real Life in a LinkedIn post this week. Her father Alain Champagne said the disease had evolved way beyond the numerous physical symptoms and was now severely impacting her brain. Lyme essentially hijacked her, the devastated father wrote. She was so courageous throughout this ordeal. She decided to free herself from the unbearable pain. We are confident she is now in peace and that her spirit is shining bright upon the large number of people she touched over her short stay with us. Amélie's father said her family and friends had watched her life become more challenging as the disease progressed. Despite the struggles of the past few years, she persevered through university, kept working at a respite center for handicapped kids, was starting to volunteer at a homeless shelter near our place, he wrote. The resilience and continued optimism she displayed while dealing with the ever-increasing symptoms was and remains my main source of inspiration. Amélie's father went on to describe the 22-year-old as having an engaging and empathetic personality. Despite the fact that every breath and every moment is painful at this stage, in her honor we will try to keep living our lives with the same attitude she lived hers, he wrote. A long road lies in front of us, every day. We are hopeful that Amélie is now in a position to help guide and support us through it. We will love you forever, and cherish every memory of our wonderful time together. You made us all better people. It's now up to us to rise up to the challenge. What is Lyme disease? Lyme disease, an infection transmitted to humans via the bite of infected ticks, is estimated to have affected more than 14% of the world's population, according to a recent study published in the medical journal BMJ Global Health. The study found that the rate of infection is increasing partly due to climate change, as ticks prefer warm, humid climates. They also abound in grassy or wooded areas, fields, and areas with high rodent populations. According to NSW Health, only some species of ticks are capable of being infected by the Borrelia bacteria which causes Lyme disease, and only these infected ticks can pass the infection on to humans. These ticks are commonly found in parts of Asia, Europe, and North America. Related ticks occur in Australia, but these have not been shown to be infected with Lyme disease Borrelia bacteria. The most obvious symptom of Lyme disease is a bullseye-style rash, but symptoms can often be less obvious, making it difficult for doctors to pick up. Some other common symptoms can include facial palsy, drooping, neck ache or stiffness, tingling or numbness in the limbs and extremities, and cardiac irregularities. If it's not treated quickly with antibiotics, the infection can spread to the joints, the heart and the nervous system, according to the Centers for Disease Control and Prevention. The knock-on effects can include arthritis, serious headaches, neck stiffness, shortness of breath, nerve pain and inflammation of the brain and spinal cord. Well-known sufferers of Lyme disease include Lady Gaga, Justin Bieber, Avril Lavigne, and Amy Schumer. Lyme disease patients often have an increased risk of mental and affective disorders, suicide attempts and suicide, according to a study published last year in the American Journal of Psychiatry. Depression is fairly common, another study of Lyme disease published in the same journal found. Delayed diagnosis can exacerbate both mental and physical issues, Dr. Andrew Nowalk, a clinical director of infectious diseases at UPMC Children's Hospital in Pittsburgh, told Today.com. Folks who have a delayed diagnosis, because of the vague nature of some of the symptoms sometimes, can suffer greatly from a lot of chronic symptoms that even the antibiotics don't seem to do a lot for in individual patients, he said. So it can be a very trying and at times debilitating disease if the diagnosis is made late. Even after diagnosis and with treatment, patients can still experience a range of symptoms, including fatigue, muscle pain and brain fog. The first step is to treat the patient with appropriate antibiotics, because you need to get rid of the infection, Nowalk said. But the challenge of late Lyme disease is that those symptoms that the patient had for a while often don't respond quickly to the antibiotics. How to protect yourself from Lyme disease? There are some measures people can take to protect themselves from Lyme disease. If walking in areas likely to be inhabited by ticks, cover up and stay on path. Use insect repellent. Check your skin regularly. Keep your immune system boosted. Shower soon after being outdoors and immediately wash and throw your clothes in the dryer. Check your pets for ticks. If you do see a tick, remove it immediately with fine-tipped tweezers. If you need help in a crisis, call Lifeline on 13 11 14. For further information about depression, contact Beyond Blue on 1,300,224,636 or talk to your GP, local health professional or someone you trust. For more engaging lifestyle content, visit 7Life on Facebook. And finally, thank you all for watching the video. Please like and comment your opinion so we can discuss together. Don't forget to subscribe, press the bell to follow and update many other interesting news. See you in the next videos. Goodbye.